and welcome everyone. This is Qendresa, Influencer Marketing Director at EvenSkyn, and I'm thrilled to be hosting another live event. Today we have a very special guest, and that is Dr. Davin Lim. He is an award-winning, board-certified dermatologist, and he is known for his approach towards skincare. You can find, even though he's practicing the dermatology, he has different patients and he has been working with so many different treatments in Brisbane, Australia. You can find and learn from his practices from his YouTube and Instagram channel. So he has been creating so much content. And I think his intention with his content is more about to cut through the mysteries and like the hype when it comes to skincare industry. I'm gonna invite Dr. Lim to be joining here. This is a chance for many of us to get to learn from the best. What we're talking and what we're exploring is the intricacies of radiofrequency and microcurrent and some of like the misconceptions when it comes to anti-aging treatments, the differences between in clinic and at-home treatments. Davin, I am accepting your invite. Let me know if you can join. Okay, I'm sending the invite to you there. So for anyone who's joining here, we're going to be talking to a board-certified dermatologist, Dr. Davin Lim. You can find him on YouTube. You can find him on Instagram. Davin, I'm sending you the invites just in case. I see you're also trying to join from your end. So let me know if you can accept that. Okay. Sometimes it just takes some time to join us here. Hi.
Morning. Hi. How are you?
I'm great. How are you doing?
Yeah, good. Cool. Super excited to be here.
Yeah. Thank you so much for taking the time to be here. It's Monday there in Australia. It's still Sunday in US and Canada.
You're in the US.
So,
cool.
So it was a bit of a challenge trying to schedule this live, but we're so happy to have you here. And it is a special moment to kind of just bring some light into questions about anti-aging and some question about some different treatments such as radiofrequency and microcurrent. Usually we get so many questions as EvenSkyn when we're talking about radiofrequency and the differences between in-clinic treatment and at-home treatment. So we were thinking that we could kind of go into a few directions in this discussion.
Sure thing. Look, these are exciting times because over the last probably 3-4 years, there's been a whole heap of at-home devices, and the papers are coming out now showing the efficacy of at-home devices, whether it be microcurrent devices, RF devices, and they even have laser devices now in the market. So the studies are coming out, and it sounds promising.
Yeah, amazing. And we are so looking forward to learn more based on your reviews and the things that you have tested before. But for anyone who doesn't know, can you please make a quick introduction about yourself and how was your journey into dermatology?
So my name's Davin. I'm a board certified dermatologist in Australia. I got into energy devices must have been about 17, 18 years ago, which means my work primarily, believe it or not, is not to prescribe retinol. My work is energy-based and injectable-based. So I work with lasers, radiofrequency, microneedling, as in radiofrequency, microneedling, whole heap of different other energy devices, including high-intensity focused ultrasound. I also do deep chemical peels, and of course injectables, whether it be your neurotoxin and your soft tissue fillers or your collagen stimulating injectables. So anything that's procedural, which I have to do in my hands, that's the realm I'm at. But having said that, obviously we've been trained in the art of dermatology and the art of diagnosis, as well as prescriptive dermatology, where we look at stuff like skincare and all the other important things like that.
And you share so much about this on YouTube. So you do your practices in clinic in Australia, but you're actually very accessible to all of us through your content. What is your intention with all of that? Like, how did you decide that you're testing different products, you're testing different skincare devices? So you're sharing so much, and I think that is an amazing thing, because like we get to learn from someone who's already in the industry, an expert. So how did you end up on YouTube and Instagram?
It's funny. I think I ended up on YouTube was about 2015, 2016. So I'm one of the older school YouTubers, and my whole aim with YouTube is, you know, believe it or not, I guess patients got to realize.
I think I lost your voice at the moment. Probably you're on mute.
It should be on now.
Yeah.
Can you hear me now?
Yes.
Yeah, cool. We just got lost of us. Brisbane, Queensland, we're very, I guess, archaic. We're still in the Stone Age, so the Wi-Fi drops in and out. Okay.
Totally.
So just to summarize, yeah, you know, when we see patients, we often do the same thing day in, day out, right? And one way to, I guess, for a better patient journey is that they come in with, I guess, ideas, or they come in educated, which I think is very important, especially when you're doing more complex things. For example, when you're treating, you know, skin for skin rejuvenation, because as you know, there's so many different treatments out there. Same with acne scarring and treatment of pigments. So what I try to do is you put these educational bites out there because patients are more informed that way. So that's the whole idea about the YouTube channel is, you know, partly for the patients, but, you know, selfishly partly for me as well, because I can go straight into the consult and at least I have some framework which I can understand prior to the consultation itself.
Yeah. Wow. That's a new perspective and amazing. And so for anyone who's joining here, thank you so much. Dr. Davin Lim has been testing our devices, the EvenSkyn Venus and the EvenSkyn Lumo, so we're going to talk about that. But if anyone has any question, please feel free to drop them here. We're going to be discussing about radiofrequency treatments in clinic and at-home treatment. So we can get started about that. And yeah, we'll be taking questions along the way. So can you explain how radiofrequency technology benefits skin tightening and anti-aging?
Yeah, so with radio frequency, it can get really complicated because there's lots of stuff out there, whether it be, you know, something like bipolar RF, monopolar RF microneedling, and there's a whole heap of different devices.
Yeah.
An easy way to, I guess, understand things is to divide it into high-level biostimulation, medium and low level, and then very low level. So when it comes to biostimulation, the whole idea about the name is to actually stimulate collagen. And to stimulate collagen, generally speaking, you need to have some kind of reaction. So either be a chemical reaction or biochemical reaction, something like with your skincare, whether it be your retinol or retinoids. That one gives you very low biostimulation. So you're not going to get plumper, as in, you know, you're not going to get volume. You're going to get some improvement with your very fine lines and wrinkles, but that's more hydration of the skin. So the amount of collagen that's stimulated by skincare is negligible, but it's still very important. That's why it's very low biostimulation. And then you have low, medium, and high. Now, generally speaking, for RF, the home use devices provide you your low level biostimulation. In other words, there's something out there in the background that's stimulating your collagen, right? And then the in-clinic RF devices, they're the ones that usually give you medium to high level biostimulation. Very different because the ones in clinic often require sedation. So, you know, patients are either knocked out or have a lot of anesthetic. And then we use higher energy devices to target certain areas. So radiofrequency works by heating of the skin. So what we want to do is we want to heat the skin to somewhere around 68 to 70 degrees for short periods of time. And what that does is that it stimulates what's known as your heat shock protein, HSP 70, 90, 92. And what happens with that is it stimulates fibroblasts, or your cells which produce collagen, to wake up. And as a result, they lay down what's known as type 1 collagen. And that can improve your skin by tightening your skin.
Yeah.
Radiofrequency, on the other hand, also works by putting heat. And when heat occurs in your skin, it can cause collagen contraction.
Yeah.
So these home devices can cause some amount of collagen contraction, and thus you can feel the skin, it feels tighter and firmer as well. So that's the whole idea about RF, to stimulate heat and to contract collagen.
Yeah, that is a very simple way to kind of understand, because sometimes people are confused. And me, myself, when I started working in the anti-aging industry and I started my own research, it was like I was bombarded with so many terms. I was talking about ATP, and we're talking about fat loss, and we're talking about radiofrequency and microneedling. There are so many ways and so many treatments that we can do. You kind of need to understand this in a simple term, like what does radiofrequency exactly do, and how we can also combine with other treatments as well. There are different devices in the market, and there's, like, for example, in clinic treatment where you can do radiofrequency with microneedling. So it's so hard sometimes for people to decide, okay, this is right for me, or this other device probably it's gonna bring me the right results. So how safe is radiofrequency for a long-term use? Like, what are some potential side effects? Because we get this question all of the time. Can I probably lose fat if I do this at-home treatment? Or is it different from in clinic? What are some potential risks when we're talking about radiofrequency?
Yeah, radiofrequency, I guess the way I approach it, and it hasn't been talked much in the literature nor in the industry, and there's a reason for that, is because usually with the energy devices companies, they don't want to actually, they want to skirt the topic of you know, who is appropriate and how many treatments you can have, because that sort of stuff limits the amount of equipment they can sell, right? So when we talk about safety, I think the safety is there, but I also believe, apart from having treatments like high energy devices, I think it's very important to pick and choose and do that with precision rather than every year, let's say you're going to use a high level device. Mm-hmm. I myself approach it that way. So I've only had my first RF treatment was just 2 weeks ago, right? As in clinic. Yeah. So I've been doing this for many, many years, and myself, my first high level RF was basically 2 weeks ago in Korea. We were just testing out the product. How we follow that up is that we try to get patients to use low level biostimulation thereafter. So things like at home devices, because they are safe, right? So when we talk about, when you ask me specific questions about fat, I guess patients got to be mindful of a couple of things. So the scientific data itself is very important, right? It's very, very important. It's not anecdotal. In other words, patients don't, you know, you shouldn't base things on, oh, I feel, or my skin looks, or I had this, or I know someone who's had that. Yeah. When you look at the actual, I guess, clinical trials and look at the scientific data behind it, applied appropriately, RF is very safe. Yeah. It's much like a pair of scissors. All of these are just instruments. A scissors can give you a really good haircut or a crap haircut like mine, or it can stab someone, yeah. Right? It depends on how you use it. So yeah. when people say, oh, you know, I've had HIFU or RF cause a fat loss, if used appropriately, it does not give fat loss, right? Yeah. What some patients do or may feel like is that when they have a treatment, and that could be a part of the aging cycle, they suddenly jump onto that cycle. And that cycle, basically, when you lose fat, you may lose deep fat, and that's purely coincidental. Yeah. Okay. So when it comes to even in-clinic devices used appropriately, they're safe. Home devices, they're 100% safe because they act as low-level biostimulation. Yeah. So the heat generated is not as much, they don't go as deep, but they're very useful for maintenance. Yeah, it would be like having kids' scissors in this case for at-home use. Like, you can do things with that, it's going to cut, but it's not going to cause too much damage because there are some safety. And of course, like, each device that is in the market usually goes through many tests and procedures and approvals and certifications. So otherwise, it wouldn't be safe to be used at home. So, but thank you so much for explaining this in this way, and especially when you talked about fat loss after an in-clinic treatment, because you would kind of blame that it was because of the treatment or because of the person that did the procedure on you, and you would say probably it wasn't a trained professional or something. But it makes sense. It could be part of like this aging phase when you're gonna
kind of lose more fat, and then it seems like you're getting dry. Yeah. And what about radiofrequency and microcurrent, or EMS in this case? Like, can those two be combined? Because the Lumo in our case combines radiofrequency, and it also has EMS along with phototherapy and sonic vibration and so many other features all in ones. But would you recommend something like combining those two, or having this, like the two modes at one session, or probably separating them based on your experience? How do you feel people usually get the best results?
Okay, the best results. So when you look at, I guess, from a scientific point of view, right? So when you look at tissue tightening, we have to address different layers of the skin. So you start off with bone. So certainly, you know, there's no product out there that within reason can stimulate bone. Certainly you can replace bone by using things like your dermal fillers, your injectables. But you have to look at bone, you have to look at muscle. This is where your EMS, electromagnetic stimulation, or DMS can come in handy, right? You also have your different layers of your skin, your SMAS layer, which envelops the muscle, and then you have your fat layer, which is your fibroseptal network. Then you have your dermis, which is packed with collagen, and then the top part of your skin. So ideally, when you're looking at skin rejuvenation, skin tightening, skin firming, skin lifting, we want to address all of the layers. And this is how we do it in clinic, is we combine treatments that address each layer. And in clinic, we have powerful devices, something like your M-Face, for example, or your Tri-Lift, which combines your DMS or EMS together with your RF. So the technology is sound, because this is what we use in clinic. But those devices start at around, you know, US is about 130,000 US, and each treatment cost is around $1,000, right? So is that effective? It can be effective. Is it sustainable? Most patients would say no, because when we're stimulating muscle using DMS or EMS to contract, what we can do is stimulate key muscles in the face. So these are lifting muscles, which we call them elevators, and they include your big names, you know, something like your risorius, your zygomaticus major, your minor, also forehead muscles as well. And then when you stimulate those muscles, it can cause a lift, right? So EMS works by that way, electromagnetic stimulation, right? Your RF works at the more superficial level, and you're causing contraction of collagen, both in the dermis and also in your fibroseptal network in the fat area. So if you think about logically, we're treating multiple layers of the skin. In this situation, we're treating 3 layers of the skin using 2 different energy sources.
Yeah. So, and even if would go in a clinic and get a, let's say, microcurrent treatment, to maintain the microcurrent results, I think it needs to be more continuous process, because you're going to kind of lose the benefits or the tightening effect that you're going to get.
And it would be going to the gym.
Sorry?
It's exactly like going to the gym. You can't go to the gym once every 6 months and hope to do things. You need to do your regular exercises, you know, a couple of times a week. It's exactly the same. When we talk about muscles of the face, it's no different. You can't go for a big workout and you know, have a treatment, then next thing you know, expect to have muscle tightening or improved tone that lasts 3, 6, 12 months. It just can't happen. You've got to do that continually.
And if you would go, for example, in a gym, let's say once in 3 months or 6 months, and you would like do this intense treatment, you're going to cause muscle numbness, and it would be the same as going like too high every day EMS or microcurrent treatment every day. I think that's not what we're supposed to do. It also depends on like the power of the device, but doing this in a more gradual and giving some space for our skin to heal. We usually say give space between treatments, because the healing process is one of the most important processes. Can you tell us what happens in this healing process that is so important to give some space between it? We also recommend the same for in-clinic treatments, but also for at-home treatments. Like for the Lumo, we recommend using once up to 2 times a week. So we give some space in between sessions, so then we have this healing process. What happens during that healing process that our skin is kind of glowing at the moment?
I guess much the same as, you know, going to the gym. You can train hard or you can train long, but you can't train long and hard every day. It's exactly the same thing. When you go to the gym and you're working out the muscle group, for example, if you're working your biceps, your legs, your glutes, you don't do that every day. You do that, you know, twice a week, at most. So it's exactly the same. You need time for it to heal as well. So when you look at the biochemical, processes, you've got your ATP type reaction, and you've also got your what we call neocollagenesis, in other words, collagen stimulation. And your body needs time, whether it be workouts in your face, whether it be laser treatments or muscle exercises. It needs time to heal and time to build up your collagen, much like how you go to the gym and build up muscles.
Yeah. And for someone who's just trying to figure out what is the treatment, the anti-aging treatment I may start with, what factors should someone consider before choosing an anti-aging treatment?
I think the most important is your clinical features, because with all devices, whether it be at-home devices or in-clinic devices, there's limitations of everything. So how I tell patients is the earlier you start it, the better it is. Mitigation is something we don't see. So someone who, for example, in their 30s, if you want to prevent or not prevent, there's no such thing as prevent aging, but to reduce the aging process or slow it down at least, start with some low-level biostimulation. Your devices like yours and with your radiofrequency, with your microcurrent, use that as directed. For patients who are in the more mature age group, someone in their, for example, in the late 50s or 60s, or someone who's had a lot of sun damage and a lot of collagen loss secondary to that, possibly the home devices may play not as a pivotal role in the beginning, but as a maintenance after sorting out with a clinic device.
Yeah.
So for my patients, it's hard because most patients don't understand when it comes to anti-aging and skin rejuve, it's not about that one treatment. That one treatment can certainly reset things. So when I do, for example, a big laser and then injectables, I can reset things for the patient, but then from there, they still need to maintain.
Yeah.
And then in clinic treatments may not be convenient for patients, but also may not be cost effective. And this is where all the low-level biostimulation comes in. So that to summarize, it's basically, I think anyone is a candidate for at-home devices, whether you're young or whether you're more mature. If you're more mature and you have signs of aging, that needs to be corrected with a high-level device first, and then maintained using a low-level. So I think at-home treatments covers the entire age group.
Yeah, and I was thinking the same. You would go in a clinic, let's say once or two times per year to get one of like that big effect or cause the collagen stimulation, but then in between those sessions you can do something at home, so you're not just like, okay, just let the results kind of fade away. But I think the at-home devices would perfectly fit in between those in-clinic treatments for the ones that actually feel comfortable to go in a clinic, because sometimes we get those, I am terrified to go in a clinic and get a radiofrequency treatment because it feels like too much, so I'm just going to go for an at-home device. But I think it perfectly makes sense to include at-home devices in between in-clinic treatments, and I think that would kind of complete the whole cycle. And can you share what are some common misconceptions when it comes to anti-aging and skincare? And we're talking about also skincare products in terms of ingredients and creams and products, not just skincare devices.
No, I guess the most important concept is there's a lot of crap out there. So there's a lot of pseudoscience. It's very important when you pick skincare ingredients to pick it with precision and you pick it with intent. So if you really want an anti-aging formula, go with a hard science behind it. So things like your retinol, your retinoids, your niacinamide, your ascorbic acid, your alpha hydroxy acids, your beta hydroxy acids. These are all form the cornerstone of management. And I think you'll find that most dermatologists, we just stick to the simple A, B, C, D, E, and F. So A is your vitamin A, which is your retinol. B is your niacinamide. C is your ascorbic acid. D is your vitamin D, and we do use that as an anti-inflammatory for certain skin conditions. E is your tocopherol, or your vitamin E, which is a very powerful antioxidant, and F is for ferulic acid. And those, A to F will encompass probably 95% of things which actually work.
Wow, it's so easy to remember, A, B, C, D, E, F.
That's it.
I didn't have this, but it's amazing. It's so easy to
I was
understand.
just giving I was just giving a lecture last week on you know on tretinoin and vitamin A, and then I just thought, you know what, everything just falls into place, A B C D E F, and this is what we do.
Wow.
Um,
It makes this whole understanding much easier. We're talking, it's A, B, C, D. I think everyone knows that, but can we also like integrate, how many type of letters can we integrate in a skincare routine? Because I know sometimes you're not supposed to mix retinol with salicylic acid. What would be?
I think all of these they're rules that are we call them, you know, they're not set in stone. It depends. We have to work with what we call in the industry the lowest common denominator. In other words, the person who doesn't understand stuff and just puts a whole heap on because they think the more the merrier. So these rules, these golden rules, are actually made for that particular individual, where we say you can't mix your vitamin C with your retinol, and you can't mix your retinol with your alpha hydroxy acids, and all those rules you can find anywhere. But for those who are a little bit more mindful, we can use it together, right? So for example, alpha hydroxy acids, you can use that to prime your retinol or prime your ascorbic acid. And by priming means it can increase the absorption by decreasing the amount of barrier, your skin barrier, right? So as a guide, anything, you know, if you're going to start off slow, one ingredient at a time. And it's a bit of common sense, because if something gives you skin irritation, just back off on it. So a lot of the guides can be found on, I think, probably on my social media, Dr. Davin Lim, which is the more fluffy side of things. But then that gives you the guide, which is basically the generic guide of how to, you know, combine things. So to answer your question is that's the first misconception, is that you have to use a lot of things. No, you use things with precision. If you have someone who's got a pigment problem, you might want to use pigment skincare, not chuck the whole thing in. If you want someone who's got sensitive skin, you want to use something like an anti-inflammatory, and not something which is, you know, which is too harsh on your skin. So go in your skincare with precision and have a think about what you want to do. Yeah.
And I think I would also like to add to this, to give some time to the ingredients to actually have an effect, because we usually deal with people that are like, I started this for a month and I didn't see as many results I was expecting. And it's more to do with also the expectation and being more realistic with the skincare, because it's not going to be a miracle. Dark spots or wrinkles are just going to fade away in 1 week or something. I think we usually read about 3 months or probably 6 months, depending also what type of ingredient you're using. So I think it's very important to emphasize to kind of have some more realistic expectation, because be patient with that. Because we see those amazing videos on internet, and like you see someone, this is what I have been using, look at my skin now, glass skin, I'm glowing. And then you're like, okay, I use the same product, but it's not giving me the same results. And it has to do with way more than just the product. It has to do with lifestyle, diet, food, exercise, everything. So can you probably share something based on the things that you know that are affecting our skin more than just the skincare we're using?
Yeah. So, I mean, just backtracking, I'll just spend, you know, a quick 30 seconds on this. When we're looking at, I guess, skincare companies and cosmeceuticals, because they're not regulated by the FDA, TGA, or CE, you can say anything you want, literally. You can have a skincare company and you can say, you know, use this cream, and you can have some influencer say, you know, within 7 days, my pigment's gone, my wrinkles are gone. If it's something medical that's prescribed, that's actually a you know, prescription cream or something with a bit of scientific background, that's got to be substantiated with studies, right? So the downside about using the good stuff, the stuff that, you know, is prescription medication, is that we have to back things with studies, and we're competing against cosmeceuticals which can make any claim they want. So just be very wary about claims with things like that, because if it's too good to be true, it probably is, right? And then you asked me, sorry, what was the question again? You asked me about
lifestyle and diet and
other
factors that are affecting our skin.
Yeah, that's so important. So I guess lifestyle, when you talk about things, you know, there's, when it comes to aging, there's your chronological aging, right? And that's genetically based, so you can't control that. That's your genes, that's your DNA. And then you have the exogenous aging, which is basically things you may control. And the two biggest things are your sun exposure, which means your sunscreen, your antioxidants.
Yeah.
That one you control. Smoking, you control that as well, right? And then importantly, your lifestyle changes. And that, you know, like everything else that we do, diet is very important, right? Good sleep is very important. Hygiene is very important. So all of this sort of stuff is super important because, and then even other things like, which may occur like stress, for example, because stress, you know, your elevation of your cortisol levels with stress and your circadian rhythms all over the place, which means you may be prone to acne-prone skin, right? And then that may have an effect on your endocrine system, which then has an effect on pigment. So it goes from, you know, from basically bad to worse. It's a chain reaction across all of the, all of the organs as well.
Yeah. So when we're talking about skincare, we're actually need to talk about the whole lifestyle in order to actually see results, because a good night's sleep is actually going to give you that glow that you were looking for.
Exactly. Because you can spend a lot of skincare, and if you're not, you know, if you don't have enough sleep, it's not working at optimal. Yeah. And then there's research as well from, you know, Adele Green, Prof. Green in the Sunshine Coast, and it was published, I think, about 2-3 years ago, that shows, you know, diet high in antioxidants are really good for anti-aging because your antioxidants, you know, things like your berries, your leafy green vegetables, your fruits, your fish, your nuts, all of those can help decrease oxidation, right? And the flow-on effect is on your skin as well. So obviously, when you look at a diet rich in antioxidants, there's many other benefits, health benefits, whether it be your cardiovascular system, whether it be your joints, you know, just your general health. But that flow-on effect goes to your skin as well.
Yeah. Thank you so much for sharing this. I see a question here for someone with pigment and sensitive skin. Is there something that accommodates both? So we're talking about pigment and sensitive skin.
I think the standout there is azelaic acid. So azelaic acid you can buy without a prescription. And azelaic acid is a skincare acid. It's originally derived naturally, so from botanicals, but wheat, for example, and barley. But obviously, it's made in the lab nowadays. And azelaic acid is a potent anti-inflammatory, so it's very good for your sensitive skin. That's why we use it with rosacea. It's also very good for acne-prone skin, and it can inhibit the enzyme called tyrosinase, which produces pigment as well. So to summarize, azelaic acid, 10 to 20%. You can get it through a gel, and you can use it twice a day. It can help.
Okay. And I wanted to ask, from your experience using the EvenSkyn Venus and the EvenSkyn Lumo device, what were the features that you were kind of like more impressed with, or you said, okay, this is standing out compared to the other devices in the market, or this is good for those groups of people? Can you tell us more about the experience that you had with the devices?
I think the main thing is the combination treatments, like you mentioned. I think that makes sense, right? And a lot of devices are just standalone devices. So combination treatments, I think, is very important. So we talked about EMS, DMS, and RF. I think that's super important. Comfort levels as well. So, you know, if something is going to give you a shock, and if something is very painful, you're not going to use it. I guarantee you that. So you can have a very powerful, you know, RF device that's not, I guess, that doesn't really deliver the energy in a way of which it's not as it's supposed to. That's conducive to comfort levels. You're not going to use it. So I think the comfort levels is very important as well, and you know, and being customizable is extremely important.
Yeah.
But like I said, I think if you approach it from the layers of the skin, that's probably the standout difference, because a lot of the time when you have a device, it's one device by itself. It can't deliver much else. So
yeah. So as we were discussing previously, we were talking about microcurrent and the radio frequency and how we're treating all layers of the skin.
Layers of the skin. Yeah.
And who would be the right candidate to use something like the EvenSkyn Lumo device?
So remember, I said, you know, everyone's a candidate, because when you look at the patients who are in the late 20s, early 30s, you can use that as low-level stimulation, right? So that's more prevention. And then the patients who are they're far gone, for example, I wouldn't say far gone, but for example, who are more mature, right? And they've got lax skin. To be honest, right, when you're using home devices for patients with marked laxity or moderate laxity, and then skin changes which are significant, no home device is going to help.
Yeah.
But having an in-office in-office procedure to reset their skin 10, 20, 30 years, that is very important. And then from there, they follow it up using an at-home device.
Mm-hmm.
So that's why I said this sort of stuff, this home treatment is very important, because that gives you your low-level biostimulation at an early age, but even at a later stage, when you correct your skin, your skin laxity and your skin quality, it's very important to maintain that from there on.
Yeah. Okay. I also got a question here. Best in-office treatment for mild acne scars?
It depends on the type of scar. So it can be as simple as something called TCA, which is just your little acid drops, or it can be something as simple as fractional laser. So in-office procedures for mild acne scars, they're very effective.
Yeah. Okay, so we got another comment from the lady who was asking about sensitive skin and pigmentation. Is there anything else apart from azelaic? I tried it and it reacts badly.
Sorry, what was the last comment?
The recommendation of the ingredient when we're talking about sensitive skin and pigmentation, so azelaic acid. So she said that it actually reacted badly. So is there any other alternative to that?
Yeah, so you can use, I mean, there's a whole heap of things like arbutin, for example. I just did a post on arbutin just this morning, and that's good for sensitive skin as well. So 1 to 2% arbutin, and then all the botanicals. So I can list it out, something like your licorice root extract, your bearberries, that can help as well, right? I would stay clear. When you look at, if you're sensitive to azelaic acid, you're going to be very sensitive to things like ascorbic acid. So all the other acids probably stay away from, whether it be your alpha hydroxy acids, your citric acid, mandelic acid, glycolic, lactic, ascorbic. So stay away from those, and then try to look for botanicals. So it's on my post. I think it's posted at 101.skin or the Melasma Clinic. That one you can have a look at, and it'll guide you through things. And I think I have that sensitive skincare guide as well on my website.
Okay. There is a question, best at home EMS device.
That one, I think it's hard, to be honest. I don't think there's any trials, right, head-to-head trials of all the different EMS devices. In fact, when you ask that question, even when it comes to best in-clinic EMS, DMS device, there's no head-to-head. I would love to do a head-to-head trial, but there's none. So I think it's to be fair to everyone, when you ask that, the best, it needs to have robust testing, right, from company to company.
Yeah, I 100% agree on that. I'm just trying to get some questions here. Is an ablative laser good for superficial scarring that looks like enlarged pores?
It is, but it could be an overkill as well. So, with ablative lasers, so if it's fully ablative, it's probably an overkill. If it's fractional ablative, like CO2, it can be a good choice.
Yeah.
So, so the answer is, for every procedure that we do, especially in-office procedures, it carries a risk, right? And the risk can include things like your infection, your skin color changes, all that. So a good physician would always pick a solution based upon the problem itself, rather than saying, oh, I've got an ablative laser, and everyone who comes in gets ablative lasers.
Yeah.
So some people just don't need ablative. They may need non-ablative, which is a very, very safe and also a more conservative treatment that has less side effects.
Yeah. Okay. And for anyone who's asking questions here, we're also going to repost this video on our Instagram. So it's going to be still there for anyone who needs to go back and read the questions and probably hear, because I see some questions that are repeating, but we're going to add Davin Lim as a collaborator so that could be shared on the feed too. So if you have more questions, please feel free to drop in, and I guess both teams could be able to answer back questions here. But I wanted to ask you one more question before I let you go. Is there any new technology that is in the market that you're kind of okay, this is getting me excited. There's something that we kind of has the potential to be researched further, and we're going to benefit from it in clinic, also at home. Is there something new that you have coming?
So this morning, at about 4 o'clock this morning, I woke up and I started reading. I've postponed this for many months because I think it's a hard topic to understand. It's exosomes. Right, exosome treatments. Exosomes are basically little buds of your cells which act as cellular messengers which transmit a key message from one cell to the other. So when you look at exosomes, just the research on it in the past 3-4 years, it's a big spike. Like literally, the curve is up. So exosomes are basically, you know, molecules that can be applied on your skin, whether it be topical, but it's best applied probably through absorption of your, following things like your microneedling, your RF microneedling, your lasers, that can repair skin and can reduce inflammation as well. So those sort of things, I don't know whether it excites me. It basically makes me more, makes me question things a little, because, you know, the skincare industry is huge. There's a lot of new stuff out there. Exosomes is coming up, and you know, when we look at I guess treatments supplied by in clinic treatments, they're the ones that are skyrocketing at the moment. So almost to the point where it's, you know, replacing PRP. Yeah. So for me, I'm trying to understand that, and there's a lot of, you know, there's a lot of cloaking behind that, and there's a lot of misconceptions. Because once again, it's not a medical treatment. It's more of a cosmetic treatment, which means the industry per se is unregulated. So for me, that's kind of exciting because I need to understand it. So I won't rubbish it until I understand it. So.
Yeah, and I'm gonna get myself into this and read more about this because I haven't really heard of. But I think this is a very exciting area where we could actually analyze further. Yeah. But that's something that maybe we can discuss in the future on another live to see the updates and what's going on. Yeah, well, amazing. I know you're very limited with your time, so I really appreciate so much for taking the time to be here with us and answer all of those questions. I see more questions being asked here on the chat, but maybe we can do another follow-up live whenever you are available, and we can answer and collect even more questions from the audience. But I really want to thank you so much for being here, and thank you so much for doing this amazing work.
No worries. Just to summarize this whole conversation, and I guess this is not part of sales on my part, right, but part of you guys to understand, and that's the concept of that low-level biostimulation. So just to summarize, you know, at-home devices, I think it's very interesting that that's something which patients can benefit from. And choosing the right at-home device, I think, is very important.
Yeah. So, okay. Anyone, do your research before you kind of make an investment in an at-home device, because that is really important. See the studies, see the the labs and tests that the device has done. That is something that we would highly recommend, and talk to the brands and just like hear more about the things that you can benefit from the device. But yeah, thank you everyone for being here, for asking questions. Thank you, Dr. Lim, for answering and educating us on anti-aging treatments and skin tightening. It was really a good pleasure.
My pleasure. Thanks for that.
All right. Thank you, everyone. Goodbye. Bye-bye.